Hi, welcome to Detours Understanding Acquired Brain Injury. And with us, we have Jocelyn, as you can see, and we're going to be talking about and comparing and contrasting borderline personality and narcissistic personality disorder to what used to be called and is called uh, organic personality disorder or secondary personality change, or is sometimes described as personality change due to another medical condition like traumatic brain injury, because these conditions can look very similar. And a lot of people with brain injury, acquired brain injury, do have personality changes. And so understanding that what you see in a loved one is not the same thing as a clinical diagnosis. The first thing I do want to say, and this is important to stress, is that if you have a diagnosis of a personality disorder before you had your brain injury, that diagnosis usually will carry over unless it was a misdiagnosis. And according to the guidelines, the DSM-5 TR text revision guidelines, and according to the ICD-11, International Code of Diseases 11, you cannot be diagnosed with a personality disorder after you have your brain injury if you didn't have one before. So if you didn't have a personality disorder diagnosis before, you cannot get one after as a result of the brain injury. Now, if they missed one or something like that, that's different, but it cannot be caused by the brain injury. Instead, you'll get either organic personality syndrome or you'll get personality change due to your brain injury. So if they give you that label because of your brain injury, that is incorrect. It's supposed to be coded as personality change due to medical condition, traumatic brain injury, stroke, or whatever. All right. I just want to stress that now. All right. Enough of that. Let's move on. Jocelyn, hi. Sorry about that. It's just something to stress to any clinician or anything like that.
Yeah. I want to piggyback off of that. I was diagnosed before and after the brain injury with having borderline personality disorder.
Mhm.
So I know too well all the symptoms, goals. I get it. So that's why I am willing to talk about it and I'm open about it because not too long ago, I finally accepted that I actually have this disorder
That's the
and that,
point of step too.
yeah, I actually have a problem and I'm not perfect. I've never claimed to be, but I just realized, once I accepted it, I realized, hey, this is a symptom. Hey, this is a symptom. Hey, this is a symptom.
Yeah.
It's a ripple effect.
I have an diagnosis of anxiety disorder. Surprise, surprise. But they're cross-linked. And now, first of all, about um, this is also then we'll be talking about pre-morbid, psychiatric diagnosis. Almost everyone with traumatic brain injury I've encountered has pre-morbid. So before you were injured, before your brain injury, before your stroke, before your cardiac arrest, hypoxic brain injury, whatever, has some kind of psychiatric diagnosis. I have yet to bump into somebody who doesn't have something. Usually, fairly minor, whatever, but sometimes more significant. And the thing about personality disorders, they're a usually an entanglement between the trauma, some kind of trauma of being raised, in a family environment that's challenging, and also genetics. There seems to be, because we do see in people with personality disorders, there are brain changes. Neuroplasticity applies. We can get into that later at some other time, but there seems to be a brain injury factor. So personality disorders can be thought of as an acquired brain injury too, due to the difficulty of the traumatic environments many of us were raised in. Thinner cortical structures, disconnection syndromes, things like that. But let's put that aside. And again, we'll go through, and thank you for being willing to talk about it, because that's not an easy diagnosis to talk about it. Probably the only two harder ones to talk about are things like narcissistic personality disorder and even tougher, antisocial personality disorder, which is, associated with some serious criminal behavior. Not everyone, but oftentimes. And the other thing to address is that these are normally, personality disorders are associated with behaviors that are functional. And everyone may see one or two of these and go, oh my God, I've got that. I've got that too. Yes, everyone has some of these behaviors. It's a question of degree. Is it so bad that it impacts your functioning day to day, that it wrecks your life in some way, ruins relationships, ruins family and friendships? Does it harm you in some long term way? If it does, if it impinges on your life to the point that you cannot function effectively, or that it leads to you getting fired repeatedly, or if it leads to relations that fall apart, family, you being alone all the time, you getting hurt, jailed, fines, all that kind of stuff. Yeah, then it is a disorder. But otherwise, it's like one or two of these traits may actually be adaptive. And that's true for a lot of things. This is why it's a disorder and not a disease. Okay, it's not a classic mental illness. It's a disorder.
I have it from the way I grew up and my trauma through from the age of 4 until I'm 24 now. So
Mhm.
yeah,
And then
and
also genetics.
oh,
Somebody's
mine is a mental case. Oh,
um,
yeah,
it is a it is a it's an interaction. It is an
yeah,
interaction between genetics and environment, and then you know and then brain injury adds yet another layer to all of this. But so
yeah,
the diagnostic criteria, criteria A, and like I said, this is a disorder, not a disease. So it is an amplification of things that would be helpful that become harmful. So let's go through the borderline personality disorder, the diagnostic criteria according to DSM-5 TR. I'm going to post up here. Um, I'm going to post the list, and we'll go through one at a time. So first of all, it's a pervasive pattern of instability of interpersonal relationships, self-image, and affects, meaning feelings, and marked impulsivity, beginning by early adulthood. So it means it's got to be present before early adulthood, and present in a variety of contexts. So not just at home, but at school and with friends and going out, indicated by 5 or more of the following features. So it's got to be present before you're an adult. It's got to affect interpersonal relationships, your self image, your feelings, and marked by impulsivity. So acting before you think, beginning in early adulthood. So again, as I said about being a kid, and present in all different kinds of contexts. So it isn't dependent just on with one person or on one location. It's got to be across the pond. So here it's got to be at least 5 of these things. So let's hit the list that we have. 1, frantic efforts to avoid real or imagined abandonment do not include suicidal or self-mutilating behavior, which will be covered later. So frantic efforts to avoid real or imagined abandonment. Okay,
yeah,
first.
yep. That's very well, like known for me.
Okay. A pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization of the individual or by devaluation of the individual. You either love them or you hate them. It's called splitting oftentimes. So
Oh
I think
yeah,
this person I'm with is either great or they're terrible. There is no room between. You also see this as brain injury a lot too. We'll talk about that later, and some of the other disorders. But so people you deal with are extremes. There is no middle. Um, any of that?
all of it. Like it's not fun, but it happens.
Okay. Identity disturbance, markedly and persistently unstable self-image or sense of self. So not sure who you are,
Yeah,
questioning who you are all the time, self-identity, and you know trying to figure out who you are.
Yeah, I always say I don't know who I am outside of relationships, family, and friends. Like, I don't know who I am because it's all a mess up there. But yeah, yeah,
Guess what else? You also see this with brain injury.
yeah,
Um, Number four, impulsivity in at least two areas that are potentially self-harming: spending, sex, substance abuse, reckless driving, binge eating, drinking. Do not include self-mutilation or suicidal behavior.
yeah. I have at least three of those. So yeah,
And again, that impulsivity, guess what?
I look at it as no one can hurt me if I'm willing to hurt myself.
And that heads back to that number one, which I would argue in when it comes to number one, that's probably the key feature. And for all of the personality disorders, there's usually one center, one thing at the very heart. And usually it's got something to do with self-preservation,
Yeah,
because self-preservation is, at the key for a lot, because trauma is at the heart of so many of these deep personality disorders. When we talk about narcissism later, which you don't have, but is very common and getting worse in our society, um,
yeah,
in that case, it is again a self-preservation, but blown to an extreme. Um, so, you know, five, recurrent suicidal behavior, gestures, threats, or self-mutilation.
yeah. If I feel abandoned, that's when the thoughts come in.
And the thing is, as they mentioned towards the beginning, it's real or imagined.
Yeah,
So it also relates to problems of perception, understanding. So there is a cognitive component, and it's important to keep in mind. And guess what else? Brain injury patients, you see things like this.
yeah,
Um, Affective instability, marked by a reactivity of mood, intense episodic dysphoria, irritability, or anxiety, usually lasting from a few hours and only rarely more than a few days.
yeah,
So we call this lability in brain injury, where you go back and forth. So, especially frontal lobe injuries. So, it would suggest the neurological problems lie in those same areas that many of us have traumatic brain injury. But this is something else that we would share in common. And I have some of these too. And as I said, most of you will be going through these, especially our brain injury viewers, and say, oh my God, I've got this. Well, yeah, a lot of the symptoms are the same. Those of us with TBI or, these kind of symptoms, but it's because the cause is different. But the same areas are damaged. And when we do narcissism in a minute, it's like we're going to see that you're going to say, I have that too. No, you've got something else. And we will get to that towards the end. All right. Chronic.
having which is borderline personality disorder. You have really high highs and low lows, and it all stems. Well, mine stems from my fear of abandonment. Is
And,
everybody's gonna leave me?
and that's oftentimes the behavioral core, but it changes how your brain is wired. And
Yep,
whether it's kind of like whether the damage comes from, say, whether it's bad programming. Think about your smartphone. Whether your phone is misprogrammed or whether you dropped it from the second story balcony of the hotel you're staying at, it's not going to function right either way. The difference being if you drop it from the second balcony, it's a lot harder to get fixed than it is whether it's bad program.
yep,
That's really the difference. I was dropped from the second floor balcony, and so were you, but you also had programming problems. So it's really a little harder to fix,
yeah,
right? But
yeah,
there are things that can be done in both cases.
yeah.
And so it's important to just keep at it. And that's part of why we do what we do, is to help people out. Chronic feelings of emptiness.
Yep, I
Yes.
do it at least every other day. Like I'm alone. I'm never gonna have anybody there.
Now
That's really
there's one difference. People with um, who are, who have borderline personality are are able to think more deeply usually. Those of us with traumatic brain injury, if we have damage to those areas that do higher thinking, would have more trouble with this. We often are just blank because we can't think like that. We are missing some of those abstract functions.
Yeah.
Um, Sometimes I'll feel like that, but unfortunately, I hate to say it, and I'm embarrassed, but it's like some of those higher thinking functions aren't there. So that may be something that is, or it depends on how well your higher functions are there. Maybe it's a blessing.
Yeah.
I don't know.
In a curse, I realized I spent like a week where I was writing letters. I always write, and I was like, I'm never gonna give it to the person it's intended for. And so I burned them. And then once I burned them, I was like, well, dang, I'm
Feels
not
good,
gonna
doesn't it?
have it anymore.
That feels good, doesn't it, to burn them? In fact, that's a very helpful technique. If you want to express your frustrations or you want to just share those thoughts and then you destroy them, you burn them, it helps to kind of expunge. But that's the psychological portion of the BPD. Whereas when you're dealing with traumatic brain injury and these similar symptoms, um, that's driven more by damaged neurology. And so there really isn't like as much release because you know those pathways are permanently damaged. And so you're kind of like, oh, it may look, the term is phenotypically, so on the surface, it looks similar, but the causes are different. And so, but again, you suffer both. And so it kind of blends you a little bit.
So I'm just a triple threat.
Yes, you are. All right, Len, finally, well, yeah, okay. Inappropriate or intense anger or difficulty controlling anger, frequent displays of temper, constant anger, recurrent physical fights as well.
Yeah. For me, after my TBI for the first year or two, anytime I would get angry, I would get violent.
That's the thing. This was for borderline personality, but guess what? Brain injury
I
survivors will pick a fight like that, verbal. They'll cuss you out. They're irritable. I am, which irritability, what it means clinically, is that we are like anything can set us off. So if we don't like, eh, you know, uh, if we're feeling tired, if we're feeling pain, if we're feeling um, overwhelmed, if we're feeling sad, if we're feeling criticized, mocked, if we're feeling confused, and again, it's indistinguishable.
yeah,
This is one of the problems that neuroscientists have is pulling apart what's what, and maybe it doesn't matter, um, because especially with brain injuries, because really there may be no reason behind it. There may be no, and we're just looking for an explanation. Maybe it's
yeah,
just an automatic response. And in some cases, for me, I know it is. Some days I just am feeling, and I just
yeah.
look for a good reason to fly off. And then I hurt myself in the process, not physically necessarily, but emotionally. I end up saying something stupid. And then I end up wrecking, friendship, or I end up like alienated from people.
So I'm actually on BPD TikTok right now,
Uh,
and say whenever you're having like the lows and highs, it's kind
uh-huh.
of like if you take a pop and shake it, and then open it and don't expect for it to explode. That's how it is like having BPD.
Yeah. And I would argue emotional ability, mainly the, well, the right frontal lobe,
Yeah.
which is where I have most of my damage. It's as the neuropsychologist had said to me, she said, your intellect is, I lost a few IQ points, but I lost about, she said, between 15 and 20, but I tested very high, not being, but um, she said, you're as healed as you can be as far as your intellect, your abstract thinking, higher functions are mostly intact. There are some problems within specific domains. She said, but
Yeah.
emotionally, you battle anxiety, you battle, like emotional ability, irritability, all those kind of things. And that's not really too much improved. It's from my last testing. So my effects are more emotional. And so I have these kind of problems that we're talking about here.
Yeah, I know.
Um,
I don't know, because I have bipolar or because I have BPD,
or because you have brain injuries.
but I feel feelings like crazy. And I actually just wrote a letter the other day. It was a total of 7 pages long. And
Wow.
I just, my feelings out like, this is how I feel. This is why I feel this way.
Mhm.
And yes, I burned it. So,
Well, that I kind of like that. I mean, maybe that's a good imagination exercise too. For people who are looking for like a meditative way to deal with, um, just imagine like burning it. Those feelings, like literally, uh, see it in your mind's eye. That
yeah,
feeling, like squeeze it and then imagine, because
yeah.
that would be
Just
a pretty good, like.
Yeah, just don't burn them in your house like I
Yes.
did.
Oh,
Smoked
oh,
it
mm,
up for
mm,
hours.
oh no. Yeah,
Like,
that
for
could be
over
a problem. Yeah.
yeah,
Also, if you have a burn ban in your area, and yeah, you just don't, yeah, that would be very bad.
yeah,
Um, yeah, like don't do that. If you've got to burn it, like find a metal bucket and do it, with a fire extinguisher standing by. Make sure you know how to use it, make sure it's charged. Honestly, if you're going to do that, or do it in a fireplace, make sure the flue is open. Yeah,
yeah,
because you fill your house with smoke. So make sure the flue is open. You push the lever back to open the chimney. Okay.
yeah.
If you're going to do that, I'm not advising you to burn anything, but if you're going to, be smart about it. Know what you're doing. Okay.
Mhm.
Because you
Yes.
can get in a ton of trouble if you mess it up. Do it smart if you're going to do it. I'm not recommending it. I'm talking about imagination, but if you're going to do it, make sure you're smart about it. Learn from Jocelyn too. All right, the final criteria is transient stress related paranoid ideation or severe dissociation. Like escaping into a fantasy, imaginary kind of stuff, or um, paranoid, kind of when you're under a lot of stress, becoming paranoid, kind of like people are out to get me or that kind of stuff.
I know for me, I escape into like fantasy
Mhm.
and dwell on the fantasy, and I'm like, once I come back to, and I'm like, that's not gonna happen. That's all in
Right,
my head.
right.
I
Um,
know what triggered me to burning the letters because I was like,
and
that's
that's not unusual. And the dissociation is kind of extreme. That's also common PTSD, and guess where else you see these kind of things?
brain injury.
Brain injury. Um, So this is one of the reasons why it's so hard with diagnosis, especially a person who's got, and this is part of why it's not allowed to give somebody the borderline diagnosis who's got brain injury. And as you'll see in a moment here, when we switch over to talking about um, narcissistic personality disorder, um, why you can't give a person with narcissistic personality disorder the diagnosis of narcissistic, or why you can't give a brain injury survivor that diagnosis either. Because guess what? That
Yeah.
also does the same thing. And
I
then we,
say that as we go through the symptoms of narcissistic personality disorder, whatever that's called, there's a lot of points where I'm like, hey, I might have that. Hey, I might have that. So it happens to everyone. If you're not diagnosed by somebody who gets paid to do this,
uh,
don't diagnose yourself because you'll drive yourself crazy and be
and the
like,
thing to keep in mind is everyone's got some of these traits. Everybody does.
yeah,
And it's also important to understand that many of these traits are adaptive. The reason it's called a disorder and not a disease, or considered a disease, is because it is adaptive traits that are pushed too far. All of
yeah,
these traits can be helpful defense mechanisms, but
yeah,
if you push them too far, they're pathological. And people with traumatic brain injury, strokes, heart attacks, sepsis, whatever damages your brain in those areas, as we've discussed in the past, will exhibit some of these symptoms because these symptoms manifest from damage to those areas. Whereas due to trauma, it's caused by kind of a dark miswiring of your brain, you might say, a kind of a dark neuroplasticity.
Yeah.
Because neuroplasticity is neither good nor bad. It is caused by, what you drive your brain towards or other people push you towards.
Yep.
And brain imaging studies, like, for example, this one, show how brain changes in a narcissist. Look, these people, as you see, have changes in their brain volume. Their brains are literally different than they should look. They have less volume in their brain than they should, that lost tissue in certain areas. It affects intelligence, cognition, emotion, all that kind of stuff. Thinner gray matter. They have less gray matter than somebody who does not have it. They have misconnected areas because of how they're raised, because of genetics, whole thing. All right, so let's transition briefly over to the symptoms of narcissistic personality disorder, which is diagnostic criteria 301.81 in the DSM-5-TR, or in the ICD 1011, that's F60.81. All right, so first, and you won't, oh, one other thing I want to mention, there are two types, major types, and then there's the grandiose type, who's braggadocious, full of energy, like, hey, look at me. They can be the life of the party. And then there's the vulnerable type, who are more insidious. They're shy, introverted. They're quiet. They're more like, well, here's some traits.
I know for me, I don't know if this is for BPD or for narcissistic, but before I was the life of the party, and now I'm more of like I'm quiet. I stay to myself. I like being alone.
Mhm. No, the the key feature of narcissistic personality disorder is that they feel like they're better than everybody. They feel entitled to special treatment without achievement. They may have at some point achieved something worthy of note, but they never really apply themselves. They just think by existing, they're entitled to being treated better than everybody else. They're arrogant in the grandiose type. They may not be as arrogant in the vulnerable type, but inside, their belief is they are just better than everybody else. Not for what they've done or done recently, if they've done something of note, but just because they are. It's a delusional problem. It is a problem of false thinking. And they're hypersensitive to criticism. This is the vulnerable, well, also the grandiose type. They're hypersensitive to criticism. If you criticize them, they fly off the handle, get really mad instantly. They can't take criticism. They can't admit they're wrong. It's always somebody else's fault. Let's quickly go through the diagnoses. A pervasive pattern of grandiosity, either in fantasy, this is more the vulnerable type inside their head, or in behavior, a need for constant admiration and a lack of empathy for other people. This is another important trait. Um, Beginning by early adulthood and present in a variety of contexts, as indicated by 5 or more of the following. Has grandiose sense of self-importance. They believe they're bigger, better than everybody else. Exaggerates, they'll lie about their achievements and talents, expects to be recognized as superior without commensurate achievements. So they believe, even if they don't say it, and this is again the difference for vulnerables, they may not say it, but they think that they should be recognized for their greatness, even if they haven't done anything that makes them better than anybody else. There's the delusion. They have a grandiose, they're preoccupied, their fantasies about themselves are unlimited success, power, recognition, brilliance, beauty, or ideal love, because they're so great. Let's see, believes that he or she is special, unique, and can be only understood by or should associate with other special or high status people or institutions. Well, I shouldn't be working here. I should be working at the White House, Pentagon. They may not say that, again, the vulnerable types, because they're afraid of being found out, because they really are terrified of criticism or being laughed at or stuff. They may not say it, but they act that way. Their behavior tells you. They require constant and excessive admiration. And the key comes here. They have a sense of entitlement, unreasonable expectations of especially favorable treatment or automatic compliance with his or her expectations. So if they tell you something or whatever, they expect you to do it. Even if they're down the chain at the work or, among friends or whatever, they expect you to do it because they're special. Again, delusional. Is interpersonally exploitative. They take advantage of other people to achieve their own ends. They're users of other people. These are some bad people. They lack empathy and unwilling to recognize or identify with the feelings and needs of other people. So they don't care what other people need. It's all about them and serving their own selfish interests, either overtly or covertly. They're often envious of other people or believe that others are envious of them. Again, delusional thinking. Strong, arrogant, or haughty behaviors and attitudes. I'm better than this group. I'm better than this person. That is what you look for in typical grandiose or vulnerable narcissist. Many of these things may not be spoken out loud, but you can tell by their behaviors, how they act towards others. You may see things that look like this with brain injury. The key thing that's different is intent. The intention is not to hurt, harm, or like to push others around or to use them for self-serving. And it's driven by survival with an abusive family or a family that where everything that person did was right. They were the golden child, or they were, nobody, and they're trying to prove they're somebody. It comes from being on the extremes. There seems to be neurological evidence, and we know from brain scanning they've got problems again in the frontal lobe. So what are your thoughts? You're kind of quiet on that.
Yeah, I'm just thinking that like everything you're saying, I have.
Well, you need to be. So what? You're feeling like you're better than everybody you're around, huh?
No, I don't feel like I'm better than everyone, but I do know specifically with one or two people that I'm like, oh, they do this, they're trying to be just like me. They did this, they're trying to
Oh,
be.
yeah. This is an extreme, and this is why it is important, as you point out, to seek out assistance in identifying, because it's not about like whether you see some of this on the surface. This is whether, it's like because you think you're better than everyone. These folks, the vulnerable classification, really believe they're better than everyone around them just because they exist.
Well, that's not true for me.
Exactly. And that's what's at the heart of all of this is
Yeah.
I'm better just because I am better. I'm a better breed of a person, this person's it's a defect in thinking.
Yeah.
Is what it is. And it's a delusion, it's a fixed false belief that you cannot dissuade them. They flip out if they're criticized about anything, because, well, I'm naturally superior. Who are you to be critical of me? And they're embarrassed that people find out that they're not what they, so it's all right now. So now what I want to do is just before we wrap up is touch on personality change due to another medical condition.
Mhm.
And this is what all right, so it is a persistent personality disturbance that represents a change from the individual's previous characteristic personality pattern. And this is a big part of why you cannot have something from before. Okay. In children, the disturbance involves a marked deviation from normal development or significant change in their behavior patterns lasting at least a year. From adults, it's just there is evidence from history and physical examination or laboratory findings, such as scans, or that there's direct pathophysiological consequence of another medical condition. The disturbance is not better explained by another mental disorder, including another mental disorder due to another medical condition. So you can only use one of these. So if you have like 3 different disorders that can cause change, each one's got to be defined separately.
Yeah.
The disturbance does not occur exclusively during the course of delirium. So if you're like recovering from a stroke, you cannot use this diagnosis as for during their delirious period while they're recovering. Finally, the disturbance causes a clinically significant distress or impairment in social, occupational, or other areas of functioning. And then there are the subtypes within it. The subtypes are labile type. So the predominant feature is affective liability. That's where we talked about your emotions switching back and forth quickly, like some of what you see in borderline. Disinhibited if the predominant feature is poor impulse control, as evidenced by, for example, sexual indiscretions or spending or, getting into, or aggressive type if the predominant feature is aggressive behavior. So, or apathetic type if the predominant feature is marked apathy or indifference. We see this in brain injury too, where a person just kind of, I don't care, kind of, it seems like that's how they feel, or adynamia, which we've discussed. Paranoid type, if the predominant feature is suspiciousness or paranoid ideation. Other type, if the presentation is not characterized by those above, or combined, if more than one feature predominates, or unspecified, which is common. And that's usually the one everyone grabs for, because what they're talking about is, well, a little from this, a little from that. And, it's like, we're not exactly sure.
Yeah. I've had therapists say that, like, when I was diagnosed with BPD, it's really hard to tell because I'm also bipolar.
Mm-hmm.
So I've been told, like, I was misdiagnosed, and I was
Mm-hmm.
told, no, you actually might have that.
Mm-hmm.
I've been hiding it for so long.
It's
So
hard. It is really hard to make, because the thing about psychiatric diagnosis, we can't draw your blood yet. They're working on it and tell you what you have. Brain scans help, and I always felt they should do it instead based on what regions or networks in the brain are damaged, and say you've got, frontal subtype A cluster with these features, or do like an a la carte and say these clinical features, are what you have, instead of like trying to call it a specific thing, or group 3 personality features, or group 4 disorder, or something like that, or cluster A, isolation type, or, whatever. Instead of giving it a name for a disorder like that, it would be so much easier.
yeah.
Do what they do in regular medicine, but psychiatry is a strange branch of medicine, and it does a lot of weird things. I'm sorry. And you just saw, with comparing it with that, so many of the features are common with brain injury because it's the same areas of the brain that are damaged. But psychiatry, back in the days of Freud, broke off from all of us Alzheimer and Pick and some of the early neurologists.
Oh,
Yeah, we've
um,
got to get going because our time is just about up. So we could pick this up at some other point and continue on talking about psychiatric diagnoses and some of the problems associated with them. So, shall we say goodbye? Okay, it looks like I just lost you. So, bye, guys. And just at the end. So, please click like and subscribe. Don't forget to hit that bell icon. Bye.